What is the current situation in Alberta in terms of access to community health centers, and why do you believe you need more community health centers in the province of Alberta?
We only have four community health centers in the province of Alberta, which has always been a little shocking to me. Two in Calgary and two in Edmonton. And so what we know is that the community health center model actually benefits the client and the patient best. It's that full integrated concept of health, housing, social supports, food, community, all those pieces together. And so what we find is that when many people actually come to the Alex and see what we do, they kind of say to me, Joy, this is the level of care that every Canadian should experience. But if every Canadian can experience it, those who need it most should. And so there's a real genuine interest and appetite towards the community health center model. I think for me, I would love to be able to push all levels of government to focus on looking about healthcare differently. I think the pandemic has shone a light on that, that without a home, you couldn't access, you couldn't isolate. And then if you weren't housed, you couldn't access medical attention. So it was really, really difficult. So that whole notion of bringing all of those pieces together into one model, I just think has been so valuable as a learning opportunity throughout the pandemic and the need for community health centers in this country, and specifically in the province of Alberta.
And like you just said, with that amazing model, the Alex delivers in healthcare, housing, food security, and much more. What would increased federal investment in community health centers enable you to do and to improve the health and well-being in Calgary?
I think the hardest part for us is to increase the health and well-being of the population that we serve, is because it's the well-being portion that is not funded. And so health is a provincial responsibility, but well-being doesn't seem to be funded by anybody. And so it's the well-being part that takes people from surviving to thriving, right? From existing to being successful. And so it's that well-being portion of the pie. It's that access to other things within a community health center model that I really think is the secret sauce that makes the model of a community health center very, very successful.